L-theanine is an amino acid commonly found in tea. Together with caffeine, it may produce a distinct cognitive enhancement profile without the jitters or other side effects. In addition, L-theanine has many other potential health benefits. L-theanine is an amino acid mostly found in tea leaves and fungi, and is used to help improve mood and lower stress and to protect the brain and the heart. Theanine usually refers to L-theanine, which has more potential health benefits compared to D-theanine. Some natural sources of L-theanine are tea, especially green tea, and the bay boylet mushroom. L-theanine is able to cross the blood-brain barrier and affect the brain directly. In the brain, it may target brain chemicals that regulate arousal, anxiety, pleasure, and attention. L-theanine increases brain serotonin and dopamine levels, which may improve memory and learning. It also increases the level and the effectiveness of GABA, the body's main inhibitory neurotransmitter, and it stimulates alpha brainwave activity, which may cause mental relaxation, concentration, and deep REM sleep. L-theanine may also increase glutathione levels, which is the body's most important antioxidant molecule. Given its similarity with the neurotransmitter glutamate, L-theanine may exert a neuroprotective effect by interfering with its function. There are several L-theanine supplements commercially available, especially to curb anxiety, improve cognitive function, and boost immunity. In a clinical trial on 30 healthy people, L-theanine improved verbal fluency and executive function. In 18 healthy people who are prone to anxiety, L-theanine also improved attention. In a clinical trial on 46 people with minor brain damage, a combination of L-theanine and green tea extract improved memory during a mental exercise. The combination improved recognition memory, attention span, and alertness during a memory test. L-theanine also improved recognition memory in rats, possibly by promoting brain development. A breakfast bar with L-theanine, caffeine, L-tyrosine, alpha-linoleic acid, vitamins and minerals was shown to improve alertness, attention, working and episodic memory, and executive function in a clinical trial on 95 people. L-theanine protected the brain against age-related cognitive decline in 29 elderly people and against brain damage due to aging, stress, and Alzheimer's disease in animal studies. L-theanine and caffeine are typically found together in tea. L-theanine often enhances the cognitive improvement effects of caffeine while reducing its negative effects, such as increased blood pressure. In 5 trials on 124 healthy people, this combination improved sustained and target-specific attention, attention switching, reaction time, numeric working memory, and alertness better than either substance alone. This combination also reduced the damage caused by restored blood flow after a stroke, which is ischemia reperfusion injury in rats. Taken together, there is some limited evidence to suggest that L-theanine may improve brain function, especially attention and memory. High cortisol caused by intense exercise shifts the Th1-Th2 balance towards Th2. This increases white blood cells while decreasing immune cells, which leads to inflammation and immunosuppression. L-theanine reverted these effects in 4 clinical trials on 66 athletes who were exposed to strenuous exercise. L-theanine, both alone and combined with L-cysteine, strengthened the immune system and reduced the incidence of the flu and the common cold in 3 clinical trials on 376 people. In another trial on 55 people, the combination improved the efficacy of the flu vaccination. Similarly, the combination increased antibiotic production and prevented the flu in mice. L-theanine boosted the activity of immune T cells, which protect against infections and cancer. In cell-based studies, it also maintained a correct Th1-Th2 balance towards Th1, which enhances resistance to infectious microbes in rats. In 3 clinical trials on 56 healthy people challenged with stressful situations, L-theanine reduced anxiety symptoms along with heart rate and blood pressure. Similarly, both a theanine-based nutrient drink and low-caffeine green tea reduced stress responses and salivary stress markers in 2 trials on 54 people. However, a study on 16 healthy people found that L-theanine was only relaxing under resting conditions, but not during acute stress episodes. In line with this amino acid didn't improve anxiety symptoms in 46 people with a diagnosis of generalized anxiety disorder. Chronic L-theanine as an add-on to current medication reduced anxiety, sleep disorders, and cognitive impairment in a trial on 20 people with major depressive disorder. In 2 clinical trials on 100 patients with schizophrenia, adding L-theanine to their antipsychotic medication reduced anxiety and other symptoms. In rats, L-theanine reduced anxiety, suppressed the stimulatory effects of caffeine, and enhanced the anti-anxiety effects of the sedative midazolam. Green tea with high L-theanine and reduced caffeine content improved sleep quality and reduced stress in 3 clinical trials on 50 middle-aged and 10 elderly people. L-theanine may also help with sleep disturbances caused by mental health conditions. It improves sleep percentage and efficacy in 2 clinical trials on almost 100 boys with ADHD, 20 people with major depressive disorder, and 17 people with schizophrenia. In mice, a mixture of L-theanine and the neurotransmitter GABA increased sleep duration and quality. In rats, L-theanine partly counteracted the sleep disturbances induced by caffeine. As an add-on to conventional medication for schizophrenia, L-theanine improved positive, negative activation and anxiety symptoms of this condition in 3 clinical trials on almost 100 people. L-theanine prevented blood pressure increase caused by stress or caffeine intake in 2 clinical trials on 64 healthy people. L-theanine decreased blood pressure in hypertensive rats and lowered blood fat levels in obese mice. L-theanine may lower blood pressure by increasing nitric oxide production as seen in cell-based studies. Because it also prevented LDL oxidation, it may help to prevent artery narrowing. In a clinical trial on 20 people with major depressive disorder, L-theanine as an add-on to conventional medication helped with depressive symptoms, anxiety, sleep disturbances, and cognitive impairments. L-theanine also helped reduce depression that was caused by chronic stress and strokes in mice and rats. The oral administration of L-theanine together with L-cysteine reduced the adverse effects of adjuvant chemotherapy in a clinical trial on 70 people with cancer in the stomach and the bowels. L-theanine also enhanced the anti-tumor effects of chemotherapeutic medications while protecting healthy tissues from these drugs in animal and cell-based studies. The L-theanine in tea has a dose-dependent antioxidant effect. In multiple animal and cell-based studies, L-theanine protected the following organs from oxidative damage: the brain, the liver, the kidney, the small bowel, and the heart. In mice, L-theanine, along with other components of green tea, reduce triglycerides and fatty acid levels in blood, as well as food intake and body weight. In a study in rats, L-theanine reduced the uptake of sugars and fats in the gut. L-theanine heals stomach ulcers caused by anti-inflammatory drugs in mice at a dose of 10 mg per kg body weight. It reduced oxidative damage and balanced the immune response. However, L-theanine aggravated ulcers at a 4 times higher dose. For an average adult, L-theanine is usually available in pills of 50 to 200 mg. Some people take up to 600 mg per day. For children, a smaller dose, such as 25 to 50 mg, depending on their weight, is normally recommended. A ratio of 2 to 1 L-theanine to caffeine is usually recommended. So if you are taking 100 mg of caffeine, you should have 200 mg of theanine with it to help reduce the side effects. L-theanine is generally well tolerated in clinical trials, and very few people experience mild adverse effects, such as headache, digestive issues, or sleep disturbances. Additionally, the frequency of these effects was similar in the treatment and the placebo group. L-theanine can lower blood pressure. If you have low blood pressure or take medication with this effect, it can cause your blood pressure to drop too low. Due to the lack of safety data in these conditions, pregnant and breastfeeding women should also avoid L-theanine.